Hi and welcome. I'm trying to learn medicine. Today, Blackwater fever. And after we've done that, we're going to do standing leg yoga. And if you participate in the standing leg yoga, then it's at your own risk. And this is here no medical advice. We're just learning about it. And this is an illness. And it's not the most pretty one to talk about it. Blackwater fever is a serious complication of malignant tertiary malaria, in which the red blood cells are destroyed. No, I just read the beginning to give a warning. And it seems actually that malaria can cause further complications, and this specific complication of malaria is Blackwater fever. Okay, and by that the red blood cells are destroyed. In your body there are the red blood cells, and I think these are the ones delivering the oxygen, and they are destroyed. The disease gets its name from the color of a patient's urine, which turns dark. Symptoms: jaundice. I don't know what it is. I would almost order it maybe on the menu. Okay, jaundice, whatever it is. And then also black or very dark urine, and then maybe severe kidney failure. Is that the reason for the color changing of the urine? Severe kidney failure. Duration: a day or two if the attack is mild. Causes: the exact cause is unknown, but Blackwater fever may be due to quinine, used in treating malaria since it occurs in people taking the drug. That is interesting. Okay, there seem to be people who have to treat malaria. I don't know enough about it to talk about it, and it's pretty broadly known, and I can't really add a lot. It's some form of illness people can catch, I think, from flies in Middle European regions, in Southern European regions. I don't really get it. It's the disease. Now, and some people were treated with quinine, and this medication had maybe caused it, but the exact cause is unknown. To say it is maybe through quinine is a pretty exact suspicion, and also something pretty easy to find out. Treatment: absolute rest and careful nursing are essential to ensure recovery. If there is kidney failure, the patient may need treatment with a kidney machine. Does the kidney recover? Plenty of alkaline fluids should be given, and the patient may need an intravenous drip of glucose and sometimes bicarbonate of soda. A blood transfusion may be necessary. Treatment with quinine should be stopped. And that's the end. Here's not more written to it. I wanted to know at least if the kidney is getting better, so if the health goes up again. Okay, so people can have malaria, which is a disease called for something, and then we get the complication Blackwater fever. That is maybe because malaria was treated with quinine, but the exact causes are, although they just mean we don't understand how quinine it is. And the people should do absolute rest, and they should drink plenty alkali fluids. Again, this is not medical advice, I'm just reading what is in here. Alkaline fluids, and maybe intravenous drip of glucose and bicarbonate of soda, and maybe also a blood transfusion, and the treatment with quinine should be stopped. Now, if it would not be a little coincidental, I would say no, but I don't know what intravenous is, but we just heard it, and I just want to say it here. It seems to be intravenous. It goes into the vein. Intravenous is the thing into the arm. No, I didn't know it until very recently. So if it would not be coincidental that I heard it there, I would say no, but I don't know what it would say it then when I hear it, so I don't say it now. Intravenous. It is just intravein, into the vein. Intravenous, and it is the thing into the arm, into the vein. plenty of alkaline fluid should be given, and the patient may need an intravenous drip of glucose and sometimes bicarbonate of soda. Okay, that was Blackwater fever. If you were here for medicine, then you can go directly to the next part. We will try to do now the standing leg yoga. If you participate in the standing leg yoga, then it's better here on this. We're having the feet standing together, and we're starting with a police officer. We're breathing in and lifting the arms up. And breathe out and open the arms to the side. Lift the arms up. And breathe out, open the arms to the other side. Now breathe in and lift the arms up and make an inch space between the feet. And breathe out, open the arms to the side. Breathe in the arms up. And out and sinking down for hide and seek playing palm tree. Again in and up. And out, open the arms to the side. Breathe in the arms up. And breathe out and we're going down again. Now breathe in and come up. And breathe out and we're leaning onto our knees and we're doing standing cat and cow. So breathe in and out and make a hill with the back, the cat. Breathe in into the middle. And out, make a belly with the back, the cow. Again in. And out, bring it out back. Again in into the middle. Out, round back. In into the middle. And out we're coming up with a round back, making it with a backwards shoulder. And the next exercise. Still an inch space between the feet. Breathe in the arms up. And breathe out, open the arms again to one side. Breathe in the arms up. And out and bring the arms up on the sides, down we're going down into a chair. Breathe in, come halfway up. Higher up. And out and we're coming up again. Breathe in, reach high. And breathe out, open arms to the side. Breathe in, lift the arms up. And out and we're going again down. Breathe in, come halfway up. Come higher up. And out and we're coming up again. And now we're doing the chair. So breathe in and come up onto tiptoes. And now breathe out and we're sinking down. Breathe in, come up again. And breathe out and go down. And in and up again. And out, bring the arms down, the feet together. We're going down over the down diving dolphin and down. Now we're doing the marmot. Breathe in and bend the right leg. Then breathe out and stretch the left leg. Breathe in and change. Then breathe out and stretch your right leg. Breathe in and change. And out and stretch your left leg. Breathe in and change. And out and stretch your right leg. Now we're doing the penguin. Breathe in and lift your right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in, bring the arm again down. And out and down. Now breathe in and lift the left hand up to the sky. And breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, the arm again down. And out and down. And we're doing the pelican. Make a hand lift space between the feet. Shift the weight to the heels. And breathe in and go down. And out and up again. Breathe in. And out and up. And the last time, breathe in and go down. And out and up. And we're doing the Jabrisi's counterweight. Take hold on the elbows. And gently rock from side to side. And again down with hands, close with feet. We then come halfway up into monkey half lift. Without it go down. Breathe in, come halfway up. And out and down. And now in and becoming with the up diving swan upwards and bring the hands down. Now the garden pose, the toes pointing to the outside, having an unaligned space between the heels. We then lift the arms up. And breathe out and sink down and place the elbows against the inside of the knees. Breathe in and straighten up. And breathe out and come with the back up. Breathing in and down. And out and up again. Again in. And now out and we're coming up in one straight line slowly upwards. Stop. Now we're going to the end of the mat, so it's not completely standing. And we're going down into high plank. And we're going into the downward facing dog. Walk a bit in. And now bring left leg up on the first leg. Bring it in front. Come a bit up and place the elbow against the outside of the first leg. Turn over to the side. And we're going down again. Bring the leg again back and we're going again into the downward facing dog. Now bring the other leg up and bring it in front. And now turn it to the other side. And we're going down again. And we're doing the bobslide. So breathe in. And we come back and out in front. Again and back. And out. Again and back. Out. And out back into the downward facing dog. Now we're doing the stretching dog. Come up on the tiptoes. And do a crevasse climb up with the knees in. Again, stretching dog. Downward facing dog. Walk in. And we come slowly with the round back up. Back to the top. Back pajama. And now a modified garden pose. Toes are pointing to the outside. Hold a little space between the heels. Breathe in with the arms up. Then breathe out and sinking down and placing the elbows against the inside of the knees. And now breathe in and straighten up the back. And breathe out, tuck the pelvis in, and come with the crown of the head first up. Bring the arms again down, and breathe in, lift the arms up. And breathe out again down. Elbows against the inside of the knees, breathe in, straighten up. And breathe out, tuck the pelvis in, and come with the crown of the head first up. Arms to the outside, and breathe again in. And one more time. Out and down. Elbows against the inside of the knees. Breathe in, straighten up. And out. Tuck the pelvis in and come with the crown of the head first up. And the arms down. And we're ending with the eagle's wings. Feet are standing together. Breathe in, arms up. And out. Arms down. Again in, arms up. And out and down. And in, arms up. And down. And we're ending with a cactus collecting its stings. Breathe in. Bring the hands to touch and lower the hands down to heart center. That was for standing leg yoga. I thank you very much and until next time.